Preclinical Skills 2. Assisting a Class 2 Amalgam Restoration. You will need You have 30 minutes to complete the skill.
To begin with, the assistant would locate the X-ray and put it on the X-ray viewer. The dentist would then ask for the mirror and the explorer to check the tooth. In this video, we will be doing a 3.5 MO amalgam. The topical will be placed by the assistant. And then the anesthetic handed to the dentist. Now that the dental dam has been placed by the assistant, I will take the mirror and my high speed and we will start preparing the tooth while the assistant uses the high volume. When the dentist is finished drilling, the assistant will rinse out the cavity prep. And the dentist will use a slow speed to remove any sort of gross decay. Because it does not generate any water, it's crucial that the assistant rinses afterwards. At this point, a spoon excavator is important for removing any extra decay. Explorer. And the dentist will usually ask if there's any other instruments that are needed. At this point, we are good to fill. Now that the tooth is prepared, the Toppelmayr band will be placed on by the assistant. The positioning of the Toppelmayr band has already been predetermined. And once seated, tightened. And now a wedge will be placed interproximally, and in this case between 3.5 and 3.4. Now that it is in place, double check that everything is perfect. And we will burnish at our contact point. Next, we will mix the calcium hydroxide. clean your spatula beforehand and will be placed by the dentist. We will also place a glass ionomer on top of the calcium hydroxide. And will be placed over the floor of the tooth by either the dentist or the assistant. This will now be light cured as per manufacturer's Finally, we will place the varnish on all exposed dentin. We are now ready for our amalgam. Now that the amalgam is triturated, it will be condensed into the carrier and transferred to the dentist. And condensed using condensers or pluggers. Once the tooth is slightly overfilled with amalgam, the assistant will hand over the burnisher. To burnish the occlusal amalgam, followed by the explorer to remove any excess. Along the Toffelmeyer. Now we will remove the wedge as well as the Toffelmeyer. Toffelmeyer is unscrewed and then the band removed. The explorer is then handed. Remove any sort of excess around the gingival margin. The burnisher can be used to also clean up the occlusal. As for dentist requirements, and the hologram, please. Different instruments for carving will be passed back and forth. Now that the amalgam is carved for the dentist's liking, the rubber dam will be removed. rubber dam cut. Go. Once the rubber dam is removed, the patient is given a rinse. And the occlusion is checked with articulating paper. The patient is asked to bite gently onto the tooth to see if the amalgam is high, if any adjustments are needed. When you're done so, adjustments are made, you recheck the occlusion, and if it looks good, the patient is dismissed.
You just had an amalgam filling done today. Please don't chew on that side of your mouth for a day. The amalgam takes 24 hours to harden, and you're frozen as well on that side. Please don't bite your lip, your tongue, or your cheek. You won't feel it now, but you will when the freezing comes out. And for eating, just eat on the opposite side.